patient here today is Adam Smith. His date of birth is July 4th, 1978. He's a 39-year-old male with a history of neck cancer, so he has a trach collar. His last section was 2 hours ago, so we'll be going ahead and sectioning him. Was there any questions that you had for me?
Yes, what was his last O2 reading?
His last O2 reading was 88.
Okay, and that was 1 hour ago, or how long ago?
Yes, it was an hour ago when CNA took it.
Oh, okay. And how about any oxygen that he has on?
Yes, he's on 2 liters and he's receiving the collar.
Okay, okay, so that's trach suction right here, huh?
Correct.
Okay, thank you. Thank you. So I'll be walking into the room.
Douglas? Good?
I'll be knocking you like.
Oh, the test!
And I'm gonna.
Yeah, I was done in 15 minutes.
So I knock, make sure I do hand hygiene.
Took me 15
so I'm gonna,
minutes.
Either use hand
Started at 2:15,
sanitizer
I was out of there at
or like
2:30.
wash.
It's like 60.
So I'm going to do
Yeah.
participation.
I know,
I'm
right?
a nursing student
monster.
here, and I'm going to be
That's how you know you're a
helping
nursing
you
student.
with
Okay,
your
the
trach collar. I'm
non-nursing
gonna
student
suction,
class.
so take
Some of them were a little like,
and
I was
also
like,
clean the area.
but I didn't
where your neck
overthink
is,
it,
okay?
whatever came.
And I just want to make sure your date of birth
But
and
I
name.
like the,
So Adam
these
Smith.
are pretty easy to read though. They're pretty clear.
Pretty straightforward.
Yeah, they were
So Adam
straightforward.
Smith.
You can identify
Adam
The
those.
ones in the
Smith.
book were sometimes a little
And
complex.
we were
They had
born on July 4th. Great. So he would have a name ID. He doesn't have one. But you just want to double check
2
that.
millimeters up there.
And there might be like an additional like skill that the teacher would probably like test you on. Like
Say again?
for example, his bed right now, for someone that has a trach collar, they have to be at 45 degrees. The bed might be lower, and you would come in and fix that. If the sheets are on the ground, that they could get dirty. So that's a precaution. So you want to fix something that the room will not have. So before I do his physical assessment, I'm just looking around to see what I have. So I have, as I was told, 2 liters for his air. I have a normal saline bottle, so that's part of my supplies. It's new, unopened. It doesn't have a date. It's new. So I know, like, I'll have a normal saline bottle. I'll clean the table with these. So I have my suction device. I'll be testing it in a little bit. So now I'll do a physical assessment on him. So what I'm going to be doing is I'll lift up the bed, and I'll tell him that I'll be lifting up the bed. And Mr. Adam Smith, I'm just going to check your lungs, okay? So if I want to, I can put gloves on, but I already did hand hygiene. If I had an alcohol swab, I can clean the alcohol with alcohol, my stethoscope. So now I'm gonna check his lungs. And you can already hear that he has crackles. So crackles are audible when someone has fluid in their lungs. So you start with right. So you start right. Okay, and then you go left, and then you move down, so down. Okay, and then here. Okay, and you're gonna do that like this, to the side, down, to the side, down, to the side, up till 10, and you're gonna end up here, here, like mid-clavicle. On both sides, you have to test that. And you can even do back sounds, but right now, we already know that he has crackles and he needs suctioning. So we did the physical assessment, we already checked our supplies, and I just want to double check the suction machine. So I'm gonna put gloves to check the suction. We have our supply, we have a trash can here, so we can use the trash can to throw away what we're gonna use. So I'm just gonna check the suction machine. So the tube is here, it's wrapped around in a towel.
Christine called me right now.
So I'm gonna check it on the other side. It has to move around a lot.
Oh, that's nice.
So you just turn it on here, and it shows here like the level of the suction, and right here it's like medium high. That's what it has to be, and you just double check. So this, I'll show you right now that this is what we do with the suction to so we can suction his lungs. So our suction machine is working, and I'm just gonna go gather my supplies. So I'm gonna put this on the other side. I'm gonna leave the room. So since I'm gonna leave the room, I want to make sure the bed is down. And you have your combo here. So if you need anything before I come back, I'll be back in like less than 5. I'll be back to help you. Okay. But if you need anything, here's your call light. Make sure I wash my hands, hand sanitizer, or actually wash them. I already have my supplies here. I already have my supplies here, but normally they would be in the respiration closet on the other side of that station up there. So what we're gonna need is a suction catheter kit, and it tells you what it has here. So it does come with gloves, I believe. Catheter, yeah. Well, you can see here that they have gloves, but I always get extras. This is my size. So we have this is for the suction. We saw that we have normal saline already, so it's hydrogen peroxide. It's hydrogen peroxide, and it's new also. So we're gonna date both of those. I have extra gloves because we're also gonna do tray care, and I like this one because it shows what it has. So it says it has the tray, it has powder-free gloves. So it does have gloves, but I'm gonna take some extra ones. Gauze, but we want extra gauze in case. Like we're gonna do little wontons, and we're gonna clean the tray collar, and it has the tray dressing. So that's the one that has a slit. So we need that and extra sterile gloves. So I'm gonna come in the room, place my supplies on the table, and I want to clean the table. Hand hygiene. Make sure I clean my hands. And I'll turn on my machine already because I don't want to have to come back over here. I'm also gonna.
I didn't realize it's totally so they're like.
I'm gonna disconnect this and loosen it up a bit, and I'm gonna hyperoxygenate. So I'm gonna, since the O2 is on this side, I'm just gonna like bump it up to the highest setting, just so to make sure he's still getting oxygen, to make sure he doesn't dry up, because this goes to his neck. So I just want to make sure that's kind of just like, it's called a blow by. So you want to make sure it's like still like around there. Okay, just because I don't want to come back to this side of the room. So I'm gonna park my station. I already did hand hygiene. I'm cleaning my table just to make sure I have my supplies here. I'm gonna, I would close the drape for privacy, like make sure he has privacy. So I clean. Okay, so I'm gonna do a suction. I already did the blow by oxygenation. I tested my machine. I'll put on gloves. I'll put on clean gloves. So what do I need for my suctioning? It basically pretty much comes all in the kit. So I'll put these things on the side. These are for my neck still. I might need these sterile gloves because sometimes those gloves are too small. So I just opened my kit and I opened it away from me because I'm considered dirty, and the packaging is sterile. So I'm gonna open this away from me. So I'm gonna put it like this. Okay, like that. Okay, so I'm gonna grab my gloves. Oh, this is the suction, the suction kit. Okay, so we have our box here, and this box we can open up like this. The inside is sterile, so you can't touch that, but you can pour the normal saline into that. What? Oh, here are the gloves. So the gloves, we can open the packaging. This is sterile. But the inside of the paper is sterile too, so you can just open it like this. Make sure you only touch the outer rim of the packaging. So my sterile gloves are there, as you can see, and I just want to prep everything before I put on my sterile gloves. So I'm gonna pour my normal saline. So this is my normal saline. I'm going to date it since it's new, so I'm gonna write the date on it with my pen or marker. Blah blah blah. So today's date. Okay, so I'm gonna pour this. Just pour it. Put the lip here. I mean, put the lid there. And it's a new normal bottle, but I can always clean the lip by pouring some out. I'm just gonna fill this with normal saline. Okay, so place out here. And I'm ready to do the suctioning. So this is on standby. And make sure I'm gonna lift up the bed. Because I need to be able to work around here. I'm also gonna put the side rail down just because it's easier for me to lean over. Okay, so I'm in a good position. want to be as close to the patient as possible to keep it as sterile as possible. Okay, so I have my suction device here. Okay, so time to use the sterile gloves. They might not probably fit me, so if they don't, you want to grab the inside of the glove because that's going to be the dirty part. So I'm grabbing the inside of the glove. So I'm going to put it on. Try not to touch the outside. So I'm touching the inside of it. Okay, it's okay if we didn't get all the way around because we're gonna adjust it with when we have the other gloves. So the other gloves, this part is sterile, so we can only reach underneath. Sterile to sterile and dirty to dirty. So I'm touching the inside of the glove. Okay, so now we can adjust. So I'm adjust here. I'm touching the inner rim. Okay, so they're on. So now I'm sterile. So I'm in the sterile field. I can touch my sterile items. So I have the tube and I'll coil it in my hand so it can be easier to insert. So I'm coiling it. And then now this is gonna be my sterile hand. I'm gonna use this hand to touch everything. So I'm gonna move this a little out of the way, just stretch it out. Okay, it is on it is hyper oxygenating and it is blow by, so that'll help. And now I just need to connect it. So here's the suction, it's working. And then I'm gonna connect it. Okay, and to make sure it works, I'm gonna suck some normal saline. So when I put my finger on this, the suction is now through the tubing. So see, it's not suctioning anything, and here it suctions. See? Okay, so I tested it; it's working. I can't touch this hand. This hand's sterile. So now I'm gonna suction him. So I'm gonna give guidance to him. So okay, Mr. Adam Smith, I'm going to put this in your throat. Okay, so he's gonna So can you just excuse me? Okay, so I'm going in, okay? I just go in. I'm trying not to touch anything else. Okay. Okay, so I hit there already, so I'm gonna pull out as I suction. Okay, so that was one. Okay, so we have to allow 1 minute for him to breathe, and we're gonna clear the line by suctioning. So suction. So just to clear the line of the fluids. So now what I'm gonna ask Mr. Adam Smith to do is turn. He's already slightly turned to the left, but he's gonna turn to the left so the tube could go to the right lung, and I can suction the right lung. So it's been a minute. So could you please turn to the left? So I'm gonna ask him to turn to the left. And I still have it coiled in my hand. It's not touching any part of his body. So now I'm gonna insert it. Okay, I'm gonna insert the tube again, okay? Turn to the left. He's gonna turn to the left. So I'm inserting it again. Okay, now suction as you come out. Okay, just one more time, okay? So we wait another minute. We could only do this 3 times, the suction. So I'm just gonna clear the line as he suctions. As he breathes. 1 minute. Okay, so I'm just gonna do this one more time. And he's gonna turn now to the right, if this were an actual live patient. So he's gonna turn to the right, and that's what I'm gonna, okay, Mr. Smith, now I'm gonna do the other side. It's been 1 minute, so I'm gonna do it again, okay? This is the last time. So we put it in quickly. Oh. Okay, and he's turned to the right, and then we're gonna suction. And it's, he doesn't have anything because he's a mannequin, but if he did, it would make a noise. And then just clear the line. We're all done. And then how do you feel? He's breathing a little bit better. He's clear. Of course, he would have coughed and stuff. So now we could just wrap this in our arm, in our hand, and then this goes back in the towel. Now we're done with the suctioning part. So this is just kind of like the after. So now we wrap this up, and we could clear these things. And we're gonna do an assessment like prior to that. So we're gonna turn down the oxygen. So he already got his. So I already did the suctioning there, and we'll buckle this. Okay, so I just have to turn down the oxygen back to 2 liters. So back to 2 liters, and then turn off the suction. We don't need it anymore. So now I'm gonna do the other skill.